The large intestine is the terminal part of the gastrointestinal tract. The overall functions of the large intestine are the completion of absorption, the production of certain vitamins, the formation of feces, and to expel that feces from the body. So the large intestine is about 5 feet long in living humans and extends from the ileum to the anus. Structurally, the major regions of the large intestine are the cecum, the colon, the rectum, and the anal canal. The opening from the ileum into the large intestine, remember, is called the ileocecal sphincter or valve, and it allows materials from the small intestine to pass from the ileum of the small intestine, the last part, into the large intestine. Hanging inferior to the ileocecal valve is the cecum, and it's a small pouch. Attached to the cecum is a twisted coil called the appendix. It's thought that the appendix, you can see here in this image, contains sort of a storehouse of bacteria, so that there's always a way to replenish diminishing bacteria that normally live in our colon. Now, this, I said, is thought. The exact function has never been truly determined nor understood. And going back to the cecum, the open end of that cecum merges with a long tube that we commonly call the colon, which is divided into an ascending, transverse, and descending colon. The ascending colon on the right side of the abdomen reaches to the inferior surface of the liver, so the liver would be sitting right up here. And then it turns very sharply to the left and forms a curvature. Remember, the liver is going to be sitting right up here, so that's known as the hepatic flexure. The colon continues across the abdomen to the left side and makes another curve. The spleen would be sitting right here, so this is known as the splenic flexure. And then it's going to pass inferior to the level of the iliac crest, where it becomes known as the descending colon. The sigmoid colon begins near the left iliac crest, projects medially to the midline, and then terminates as the rectum about the level of the third sacral vertebrae. So rectum in the human body simply means straight. So the rectum is about 6 inches in length, and it lies anterior to the sacrum and the coccyx. The terminal 1 inch or so of the large intestine is called the anal canal, and the opening of the anal canal to the external environment is called the anus. So the anus is surrounded by an internal anal sphincter of smooth muscle, and remember that's involuntary, and an external anal sphincter of skeletal muscle that is voluntary. So these two sphincters together keep the anus closed, except when we're trying to expel feces. The wall of the large intestine contains, again, those typical 4 layers that we find in the gastrointestinal tract: the mucosa, submucosa, the muscularis, and the serosa. The epithelium contains mostly absorptive and goblet cells, and the absorptive cells function primarily to resorb water. The goblet cells secrete mucus that lubricates the passage of the contents through the colon. The portions of the longitudinal muscle are thickened, forming bands called tinea coli. So you can see those here. These are your bands. That's your tinea coli, and they run most of the length of the large intestine. Contractions of these bands gather the colon into series of pouches called haustra. So each of these little pouches that you see along the length are the haustra, and that's what gives the colon its somewhat puckered appearance. Movements of the colon begin when substances pass through the ileocecal sphincter into the ascending colon. So as food passes through that ileocecal sphincter, it fills the cecum and accumulates in the ascending colon. One of the movements of the large intestine is called haustral churning. Remember, those haustra are the pouches that are formed, and they remain relaxed but become distended when they fill up. So when the distension reaches a certain point, the walls contract and squeeze the contents into the next haustrum. Peristalsis also occurs, even though it's at a slower rate of about 3 to 12 contractions per minute, more in the proximal portions of the tract. A final type of movement is called mass peristalsis, where you've got these really strong waves of peristalsis that begin at the middle of the transverse colon and quickly move the contents of the colon into the rectum. Mass peristalsis usually takes place about 3 to 4 times a day during or immediately after a meal. The final stage of digestion that occurs in the colon is through the activity of the bacteria that inhabit or live in the lumen. So mucus is secreted by the glands of the large intestine, but no enzymes. Chyme is prepared for elimination by the bacteria, and they're going to ferment any remaining carbohydrates, and when they do, they release hydrogen and carbon dioxide and methane gases, and these gases contribute to flatulence in the colon when it becomes excessive. And of course, when we pass gas, it is the odors from this that cause the smell of that flatulence. Bacteria also decompose the bilirubin down into smaller pigments, and that includes stericobillin, which gives the feces its brown color. These bacteria also produce vitamin B and vitamin K that we need as part of our metabolism, but can't produce, so they produce it for us. By the time the chyme has been in the large intestine for about 3 to 10 hours, it's now become solid or semi-solid, because in the large intestine we resorb water, and now that dry, solid, or semi-solid is called feces. Chemically, your feces consist of water, inorganic salts, sloughed off epithelial cells from the mucosa of the gastrointestinal tract, bacteria, products that the bacteria created during their decomposition of the food products that we couldn't absorb. So we have those unabsorbed digested materials and indigestible parts of our food. About 90% of all water absorption occurs in the small intestine, but the large intestine absorbs enough to make it an important organ in maintaining our body's water balance. Of the 1/2 to 1 liter of water that enters the large intestine, all but about 100 to 200 milliliters is normally absorbed through osmosis. The large intestine also absorbs ions, including sodium and chloride, and some vitamins. Mass peristalsis pushes that fecal material from the sigmoid colon into the rectum, and it results in a distension of the rectal walls. That's going to stimulate stretch receptors, which initiate a defecation reflex that usually results in defecation, or getting rid of the feces from the rectum through the anus. The defecation reflex occurs in response to distension of the rectal wall. The receptors are going to send sensory nerve impulses to the sacral spinal cord. Then motor impulses from the spinal cord travel along parasympathetic nerves back to the descending colon, sigmoid colon, rectum, and anus. The resulting contraction of the longitudinal muscles in the rectum shorten the rectum and increases the pressure inside it. This pressure, along with the voluntary contractions of the diaphragm and the abdominal muscles, plus parasympathetic stimulation, opens the internal anal sphincter. If the time and the location is right, the external anal sphincter can be released. Now remember, that's under voluntary control. So if it's voluntarily relaxed, defecation occurs and the feces are expelled from the anus. If it is voluntarily constricted, then the defecation can be postponed until the time is right. Some homeostatic imbalances associated with the large intestine include appendicitis, which is an inflammation of the appendix. It's usually characterized by a high fever, elevated white blood cell count, neutrophil count higher than 75%. The infection that follows can result in edema and ischemia and may progress to gangrene and perforation within 24 hours. Typically, appendicitis begins with referred pain in the umbilical region of the abdomen, followed by a loss of appetite, nausea, and vomiting. Several hours later, the pain typically localizes into the lower right quadrant, where it's continuous. It may be dull or severe, but it's usually intensified by coughing, sneezing, or body movements, or anything that compresses the abdomen. Early appendectomy or removal of the appendix is recommended because it's safer to operate than to risk the rupture, the peritonitis, and the gangrene that can accompany that. Although it does require major surgery, in the past, today those appendectomies are usually performed laparoscopically, so much easier to remove that appendix than before. Colorectal cancer is a very deadly malignancy. It ranks second to lung cancer in males and third after lung cancer and breast cancer in females. Genetics plays a very important role, and you can inherit a predisposition, and that contributes to more than half of all cases of colorectal cancer. Excessive alcohol intake and diets that are high in animal fats and proteins can also be associated with increased risk. Dietary fiber, retinoids, calcium, and selenium can be protective. The signs and the symptoms of colorectal cancer include diarrhea or constipation, cramping, abdominal pain, and rectal bleeding, which may either be visible or occult bleeding that's hidden in the feces. Precancerous growth on the mucosal surface called polyps also can increase the risk of developing the colorectal cancer. Screening for colorectal cancer includes testing the blood for feces, a digital rectal exam, a sigmoidoscopy, colonoscopy, or a barium enema. The tumors need to be, in most cases, removed surgically. The amount of bowel movements that a person has over a period of time depends on several factors such as diet, health, and stress. The normal, quote-unquote, range of bowel activity varies from 2 to 3 bowel movements a day to 3 to 4 bowel movements a week. Diarrhea is an increase in the frequency, volume, and fluid content of the feces caused by increased motility or decreased absorption by the intestines. When the chyme passes too quickly through the small intestine and feces pass through quickly through the large intestine, there's not enough time for water absorption. Frequent diarrhea can result in dehydration and electrolyte imbalances as we're losing those excess fluids. Excess motility can be caused by lactose intolerance, stress, or microbes that irritate the gastrointestinal mucosa. Constipation is infrequent or difficult defecation caused by decreased motility of the intestines. Because the feces stay in the colon for a longer period of time, excess water can be absorbed and the feces becomes very dry and hard. Constipation can be caused by poor diet habits, delaying defecation, spasms of the colon, insufficient fiber from plant cell walls in the diet, inadequate fluid intake, lack of exercise, emotional stress, and also certain drugs can slow motility. Very common treatment is to take a mild laxative such as a milk of magnesia, which increases or induces defecation. However, many doctors say that laxatives can be habit-forming, and they advocate for adding fiber to your diet and increasing your exercise and your fluid intake. Diverticular disease is when pouch-like sacs develop in the wall of the colon. These are called diverticuli, and they occur in places where the muscularis has weakened or it may become inflamed. Development of the diverticula is known as diverticulosis, and many people who develop this don't have symptoms or no complications. However, about 10 to 25% will eventually develop into an inflammation known as diverticulitis. This is characterized by pain. It could be increased constipation or increased defecation, nausea, vomiting, low-grade fever. Because diets low in fiber contribute to the development of diverticulitis, patients who change to high-fiber diets usually show a good bit of relief. In severe cases, though, the affected portion of the colon may have to be surgically removed. If the diverticular rupture, the bacteria that are found in the colon are going to be released into the abdominal cavity, and that can lead to peritonitis. Overall changes in the digestive system associated with aging include decreased secretory mechanisms, decreased motility, loss of strength and muscle tone in the tissues of the intestines and their supporting structures, changes in the neurosensory feedback that can alter your enzyme and hormone release, diminished response to pain and internal sensations. In the upper part of the GI tract, common changes include reduced sensitivity to mouth irritations and sores, loss of taste, periodontal disease, difficulty swallowing, hiatal hernia, gastritis, and peptic ulcers. Changes that can occur in the small intestine include duodenal ulcers, malabsorption, maldigestion. Other pathologies that increase include appendicitis, gallbladder problems, jaundice, cirrhosis, acute pancreatitis. Large intestinal changes are typically constipation, hemorrhoids, and diverticular disease. Cancer of the colon and the rectum are quite common, and also bowel obstructions or impactions. Yeah, getting older is a real breeze, right? As always, I include the focus on homeostasis because I want you to be able to look at these overlying and incorporated functions of our body systems. All body systems work together, and I want you to be able to look at each system and understand how they work together for overall homeostasis. And our last little bit for the digestive system includes some disorders not previously covered, including lactose intolerance, where in some people the absorptive cells of the small intestine don't produce enough lactase. Lactase, of course, breaks down lactose. So without breaking down lactate or lactose, we can't absorb it. So this results in a condition called lactose intolerance, where that undigested lactose in the chyme causes fluids to be retained in the feces. Bacterial fermentation of that undigested lactose produces a lot of excess gases. Symptoms include diarrhea, gas, bloating, and abdominal cramps after consuming milk and other dairy products. Persons with this intolerance need to select a diet that restricts lactose, but remember to take calcium supplements or consume sufficient calcium in the diet. Inflammatory bowel disease is an inflammation of the GI tract that can exist in two forms. Crohn's disease is an inflammation of any part of the gastrointestinal tract where the inflammation extends from the mucous membrane from the mucosa to the submucosa, the muscularis and the serosa. Ulcerative colitis is an inflammation of the mucosa and the rectum, and it's usually accompanied by rectal bleeding. Curiously, though, cigarette smoking increases the risk of Crohn's disease, but strangely decreases the risk of ulcerative colitis. Irritable bowel syndrome is a disease of the entire GI tract where a person reacts to stress by developing symptoms like cramping and abdominal pain, associated with alternating patterns of diarrhea and constipation. Excess amounts of mucus can appear in the feces. Other symptoms include flatulence, nausea, loss of appetite. This condition can also be known as irritable colon or spastic colitis.